little bit about what we've been doing and announce our new name. But before that, I would also like to welcome Governor Scott, Mayor Weinberger, Dr. Bumstead from the UVM Medical Center, and our valued partners at the UVM Health Network, Todd Keenan, as well as our chairman, Jim Crook. So, again, thank you so much for all the support we've had from the city, the state, and really everybody in the state of Vermont as we've worked to rebuild the company. Our interest as we started this work a year ago was very simple. A group of local investors was passionate about saving jobs and really about being the cog in this healthcare crisis and this opioid crisis. We knew that the public epidemic around substance use disorder had to have this business continue to thrive. And that's what we've been focused on over the last year. So what have we been doing over the last year? Really, we've been focused on building business integrity, increasing our financial wherewithal and compliance programs, driving efficiencies in our labs so that the patients and the community has results that they can count on and providers as a partner that they can count on. So now we flip the page, and as some say, a new chapter. I actually like to say we're closing the book and we're really opening a new book, and that book is titled Aspenti Health. Now, what's in a name? Everybody's asking, what does Aspenti Health mean? And there is something in a name, and that name was created purposefully. And the purpose of that is the aspen tree. The aspen tree is a symbol of clarity of purpose. It is also a community of trees, interconnected in its root system. In fact, some would say the largest living organism in the world is an aspen grove in Utah. And that aspen grove has been around for 80,000 years. Imagine that, community and connectedness. T-I, the seventh note in the musical scale, a leading tone representing harmony. Community, connectedness, longevity, harmony. That is Aspenti Health as we move forward. So what can you count on in the community from Aspenti Health as we move forward? You can count on a company dedicated to diagnostic quality, results that matter, an infrastructure and a passion for compassionate care, helping our patients in recovery and treatment. We will educate our colleagues, and our patient service centers and the interactions we have will help drive success as we all battle the substance use crisis. We also have a strong commitment to the public and private sector connection. It is clear that no one individual, no one company, no one group can solve this challenge. It takes the efforts of public and private working together to make real impact. And we are very committed to that, and you will see us move forward. Science you can count on, and compassionate care, Aspenti Healthcare. So now I'd like to turn this over to Governor Scott, for him to share a few words. Governor Scott, thank you.
Thank you very much. Well, thank you very much, Chris. And to sum up our challenges, we know we have an epidemic on our hands, but every night, it literally keeps me up at night, three numbers, 6, 3, and 1. We have 6 fewer workers in our workforce every single day when we wake up. We have 3 fewer students in our K-12 education system than we did the day before. And then we have 1 baby born to an addicted mom every single day. That one number is particularly burdensome to us and highlights the challenges that we face. So what do we do about it? And from that standpoint, it means all of us coming together towards the common goal. I appointed an opioid council with a director that directly reports to me, Jolinda LeClaire, and I think that that's important, that we all get on the same page from that perspective. As well, with companies such as this coming to the table and providing an essential service as we attack this issue together is essential. So I really appreciate all you've been through over the last year, the challenges, the daunting obstacles that came before you, but you overcame that. And today you're going to embark on a path forward where we can all work together again. I thank you for doing business in Vermont. I thank you for your 140 employees. And again, as we work towards a common goal of trying to solve this epidemic that's facing our state, our country, and together we can come up with answers. So again, I thank you very much for having me here today.
Thanks, Governor Scott. I'd now like to introduce Mayor Weinberger. Share a few words with us.
Well, Chris, really appreciate you involving the city in today's event. Governor, thank you for being here and being part of this. This is an important announcement. I think it's a real milestone in the successful saving of an important company here in Burlington. Why is it important? It's important in terms of jobs, and these were jobs that were very much hanging in the balance a year ago, and it took a lot of hard work and fast work, which is not always easy in this healthcare regulatory environment, to get this done. And congratulations to your chairman, Jim Kruk, for making this happen. Thank you, Algo Bay, and your old hat for the regulatory steps that need to happen quickly to save these jobs. I think today's announcement is a sign that that effort has succeeded. The prior company, Burlington Labs, was also important in that they had long been generous in the community, an important part of the recovery community, and I think Aspenti's continued activity here in the county speaks well for having that kind of assistance. But moreover, as Governor Scott just alluded, we are in the heart of the largest public health epidemic of our lifetimes. It is, I think, not an exaggeration to say we have never seen anything quite as dramatic as the drug overdose epidemic. The Times last month, New York Times, put out a statistics I think many of you have probably seen, showing that drug overdose deaths now exceed the peak of car crash deaths. They exceed the peak of the HIV crisis. They exceed the peak of the gun crisis. And the overdose deaths are still rising like a rocket ship without an end in sight. The solution to turning this around is going to take work that those prior crises did not require. It requires collaboration and granular, local, ground level interactions unlike any of those other crises. And that is another reason that having Aspenti here in Chittenden County growing and healthy is critical. We are going to need to work together in ways that we have not even identified yet. We are going to need to understand the problem far better than we do today. The data and the information that Aspenti has, I think, could end up being very important and helpful for that. It will build on the successes, I think, that we've started to see in recent months. And I want to say thank you with the governor here and with the Secretary of Human Services here. Thank you for how quickly this new administration has jumped into this problem, how quickly they have, as a brand new administration, gotten up to speed, and the successes that they are rolling out. Just in the last few weeks, we have seen a much needed new emergency hub open in St. Albans, with the direct hard work at the highest levels of government to make that happen. We have seen also these new, much needed prescribing rules for doctors go into place on July 1st with, we all believe, the hope of seeing some real changes in the way that prescribing patterns happen here going forward. So I share that because there's clearly, for years, a lot of people have been working hard to turn this around. The fact that we haven't done it yet is not a sign that people aren't working, continuing to working. The point is, we're going to need to do more. Aspenti being here, being healthy, being successful, I think is going to be a great tool in allowing us to do more. So we're very excited about today's announcement. Thank you.
Thanks so much. So we'll begin to wrap things up. I want to share one last thought with you. One of the thoughts that I shared with the team as we were rebuilding Aspenti Health was a simple comment. Do you want to stay in the world you live in, or do you want to live in the world you dream about? And I share that with you because as we think about this opioid crisis and the substance abuse challenge we have, not just in Vermont, but in America, the world we dream of is access to information, health that's readily available, treatment and recovery that's sustainable and makes a difference. So we want to dream about the world where there is no substance use disorder and that everybody has access to care the way that they need. So thank you very much for everybody for being here. Thank you all for your support over the last year as we've made our transition from Burlington Labs to BLA. We won't change the name again on you anytime soon, to Aspenti Health, and we're very, very excited for the support we've had from the city, from the state government, and from the public and private sector as well. So thank you very, very much.
Does anybody have any questions? Mr. Powell, can you speak to how the acquisition process went and the settlement? Anything you can say about the settlement?
Well, so the acquisition process took really about 8-9 months, and through that, as any other company, we evaluated Burlington Labs. We worked to understand the business, the process, and the people. And at the end of the day, what we were focused on, again, was saving jobs, making sure that we could maintain a workforce and maintain the critical services to the healthcare crisis that we have. And we've done that. And not only have we done it, but we've expanded that. So I'm very, very excited about that.
Can you speak to the settlement at all?
The settlement was a very positive step with the state, and we are working with the state every month, and we have decided over time, we have a 7-year period where we're repaying that, and we're committed to doing that, working with the state to do that.
How much of the company structure at the highest levels is sort of the same as existed when it was Burlington Labs, and how much has changed?
Yeah, great question. So, one of the things we focused on was melding not only experience of the team that was here, but new leadership as we looked at building a business that was, soundly grounded on industry knowledge, business integrity. In fact, my leadership team is here. Our CFO, Sharon Phillip, is new to the organization. Dan Browdy runs business excellence. Dan has been with us. Kelly Kimball has been with the company for some time. My sales leader is new to the company. So we've really mixed things up. We've got our business excellence leader who started today, running operations. Our CMO is in partnership with UVM. So we really focused on bringing in both talent that understands the industry, has built successful businesses operationally, as well as leveraging the talent that we have. So we have some great talent as well. None of the existing executive team, other than Dan, is still with the company.
Is Michael Castellino involved?
Michael Jody Castellino are not involved at all with the company, no.
Is he still in the States in the company?
No, he does not. No.
For the sake of the folks who maybe loosely knew about this but don't know the company well, what is it that Aspenti Health does?
Yeah, great question. So we are, at our core, a toxicology laboratory. We take urine specimens and we test those for different drugs. That is sort of the widget that we do as a manufacturer. But the reality is, as a healthcare company, we're about recovery and treatment and working with our providers in the state to understand their patients, look at utilization, and really help understand the gaps in that care, and ultimately help reduce costs and improve recovery and treatment with our providers.
How can toxicology help understand gaps in care?
Data. I think Mayor Weinberger mentioned the use of data. We have a unique perspective on patients. Our patients travel around, we are able to collect that information. Sometimes they have multiple providers. Our data, we can centralize data, look at utilization, look at trends, so that we're making sure we're creating access, and we're using that data to understand utilization and testing trends, so that can help the provider as they build their treatment plans.
So when you say utilization, you mean the treatment utilization or drug?
Utilization of the drugs and the different types of testing that is being done for that patient.
How many employees do you have here in the building, and are you going to keep this as your headquarters, or what other sites do you have in Chittenden County?
Yeah, so we have about 90 colleagues here, and then we have about 50 colleagues throughout the state and in Massachusetts as well. We do have a lab in Massachusetts. Our plan is that we will continue to grow our colleague base. We have 10 what we call patient service centers, 9 of which are in Vermont, located throughout the state, trying to promote access to the services and to make it easier for folks to get their drug testing done. And as we look to grow in the future, we will not only leverage Burlington and the community, but we are building a new lab in South Burlington, and so part of our laboratory functions will move there. In time, we're going to continue to grow, and that's going to require us to have more colleagues, not only out in the community working in recovery and treatment administratively, but in our lab as well.
Okay. Any commitment to this site, though? Are you committed to this site for any amount of time?
Right, yeah, we are committed to site, but certainly for the next year, if not more than that.
According to my records, there were 180 employees at Burlington Lab.
Yeah, I don't ever remember that number. We came in and evaluated the business. It was roughly, in the 140 range, and we're at 140 today, and got 9 people starting next week. We had 4 start today, Vanessa, Clark, as I mentioned, and 3 others, so really a good balance of people coming into the business and out in the communities as well. And we're focused on things. We'll be spending the afternoon at a roundtable with some folks, but we're focused on also recovery. How do we employ folks in recovery? It's a very, very important topic for us, and one that we're committed to when we think about communities and recovery. There is a lot of stress on individuals in the middle of treatment, and the ability to find employment that matters and they can trust is something we're very, very passionate about. So we'll be spending the afternoon with some folks on that roundtable as well.
How many patients do you see? How many? I'm trying to get a sense of the workflow.
We do well over 100,000 tests a year. We see about, actually, Jill. Let me ask Jill, our CMO.
So last year, 2016, we had 1.8 million tests in the state of Vermont and about 10,000 unique patients.
1.8 million unique tests, but 10,000 patients that we saw. And the 1.8 million tests was in Vermont.
What are the annual revenues? What are those about?
Actually, that's company private information and confidential, and so I'd rather, we're healthy. We're going to be cash flow positive this year, and those are big steps for the company, and that's our focus: building a company that is here, that colleagues can be excited about, that we can continue to hire and grow.
Given the company's history, how important is it for you to keep track of the reimbursements and Medicaid reimbursements?
Well, I'd say it keeps me up at night. It's really important. It is the most important thing. I mean, what we want to do is always build a company that is based on doing things right and doing them in a compliant way. We're building infrastructure every day to make sure that happens. Checks and balances. Our partner at UVM is providing compliance oversight as well. Our board is built of healthcare executives that understand the importance of compliance and making sure that this is a complicated business, and it's a complicated reimbursement world with Medicaid and Medicare and commercial insurers, like any physician and any provider. Making sure that you understand how your funds are coming into the business and who you treat and who you don't treat is important decisions, and we're thinking about those decisions every single day.
How has this changeover impacted the costs, the cost to the patient? Upwards, downwards?
No, I would say, if anything, it's improved costs. As a matter of fact, we were able to just launch a program called our FAIR program of affordability in recovery, financial affordability in recovery, FAIR, patients, so that any patient can come through our doors and get assistance, financial assistance. That is the key. Access to this service is critical to their recovery, to employment, to the work with their physicians, to their families, to their jobs. So we want to make sure that everybody has access to care.
Has there been any increases in costs in terms of the tests?
No.
Patient accessibility?
No. Again, our patients to this program have access. It could be nothing, depending on how they qualify based on federal standards.
So you're announcing this new name today, but in terms of the actual service offered to the community, has there been any interruption as part of this transition or any changes there?
No, I mean, we have focused very hard during this transition in making sure that the services that we're delivering to the patients in the communities were not disrupted. In fact, we're looking to expand services. We've built a new client experience organization that is getting in front of our customers on a daily basis, working with the providers to understand what else can we do that's unique and different to really drive recovery. Ron Stankovich is with us. He is one of our colleagues. Ron's job is Director of Community Impact and Outreach. So not only are we talking about it, we actually have employed somebody in the position to help get out and understand what's going on in the community. We've built resource guides, we're holding educational sessions, and we're reaching out to different groups within the state and the community to be part of those states so that we can really be part of this discussion about solving this challenge.
You mentioned a new lab in South Burlington. Is that replacing a facility you already have, or is that
So it's an expansion. Yeah, we're expanding. I mean, our lab is, our lab is here on the second floor, and candidly, this is not the best place for a lab, given the building and age and other issues. And so the lab is moving out to South Burlington. Yeah, so the lab will leave this space and move to South Burlington.
Is it going to Dorset Street? Is that where it's going to be?
No, it's going out to Community Drive.
What's the address?
I don't have the address off the top of my head.
More to come on that later.
More to come on that later.
Is there a timeline? Do you think that's going to take place?
The lab move is in process. It'll happen over the next 8 or 9 months. But then the rest of the administration and our patient service center will stay here for an extended period of time. And I want to be clear, our patient service center, which we're looking to innovate a whole new patient service center to include counseling, education, treatment facilities, not only a collection. There's an opportunity here for us to reimagine this whole collection process so that it provides dignity to the patients and helps facilitate recovery and treatment. That's what we're going to do here. We're talking to some of our partners around partnering with us to go get grants to help create something that nobody's seen around patient treatment, and that will be here in Burlington, where many of our patients are.
Fully understand what you're thinking about the use of data. Could you explain a particular scenario where a treatment provider would change their work or behavior because
Yeah,
of their
you
data?
know, actually, Jill, I'm going to have my CMO, Jill, come up real quickly and give you a great example of that. And the question was around how data can really impact treatment providers.
I love this question.
I know, that's why I brought you up.
Yeah, I'm a data gal at my heart. So
And
I'm
a physician.
I'm a physician, so I'm an MD, PhD, and I did both training in pharmacology as well as pathology. And data really drives physician behavior. It should drive physician behavior. Unfortunately, in the field of toxicology, there haven't up-to-date been a lot of guidelines about how to support patients through drug testing, even though we've been doing it for years. Actually, my society, the American Society of Addiction Medicine, recently came out with some guidelines, but before that, there's nothing. So if you think about it, you have a provider sitting next to a patient, and you have the question, did they use a drug, right? Now the patient, unlike in cancer or in other care paradigms, the patient actually may not be working directly with the provider to answer that question. So drug testing comes into play to say, hey, what's an objective measure of whether that patient's using a drug or not, right? So then that's helpful. But what's even more important is then the provider then can take that information and carry it forward to other patients. So if I know that one of my patients has taken amphetamines, and amphetamines is in use in that area, then I know maybe somebody else is using amphetamines as well. So it can be then predictive and helpful as you have further conversations with other patients. So then what we do is if we then take that data and give that back to the provider to say, look, in the last month, nobody has used gabapentin. Look at all these people using synthetic cannabinoids. Then you see the power of it, right? Because then you're going to start testing for synthetic cannabinoids and actually capturing that and giving visibility to the patient. Look, you're using synthetic cannabinoids. What can we do to help you with this? So it's a very powerful means to actually improve the patient's success in their journey to recovery, but also communities. And as you can see, I'm sure Mayor Weinberger would like that information as well. So it has really powerful implications, not only for the patient-provider dialogue, but also for the patients at large.
Is there a data sharing agreement or building?
There isn't yet, but it's something both sides are very interested in pursuing and talking about. Starting the conversation.
Great.
Great, fantastic. Does anybody have any final questions, or does anybody need one-to-one? Fantastic. Well, thanks for coming today, and we appreciate your support. And if you have questions, please let us know.
Thanks
you.
so much.